We made it.
All right.
Another social hour. We have with us Alex McKinley, as always, my illustrious co-host, and we have Maya Turner with us today from the NAB. So Maya's going to be with us all meeting long, all hour long. So it's going to be really fun. Maya, how's your day going? What's going on?
I am extremely happy. Today is Wednesday. It's hump day. And today is like my Tuesday because I just came back from out of town in North Carolina. It's so beautiful in Charlotte. So shout out to North Carolina folks. But things are just happening. The sun is shining. They said we were going to have thunderstorms, but the sun is still shining. So that's always a good thing.
Yeah. Yeah, I tell you what, it's been hot and weird weather. So where are you at? You said you got back from North Carolina, but where are you at now?
I am a resident of the great city of food and big backs, Chicago, Illinois.
Oh, cool. Yeah,
Oh,
you had me
fun.
like on the edge of my seat there. I was like, what? Food.
What am I saying? Big backs, not big butts. I'm not Sir Mix-a-Lot. I'm
I mean, we could have a little
big
karaoke session at
backs.
the end of social hour and, maybe not bust that one out. I don't know. We'll
So,
see.
I like big. Okay, I'm sorry.
I have to say, the Maya is new to the NAB, and we've had a few interactions, and the those times are just fun. Maya, you're a hoot to be around.
Oh yeah, I'd rather ask for forgiveness rather than permission because you never know. It's just fun having to laugh. I mean, if we don't laugh, I mean, what fun is that? We got to laugh at least once a day, right? At
Absolutely.
least, or at least acknowledge that you're above ground and there's nothing else going on, right?
You're above ground, right? There's air you're breathing. We're
Man,
talking, we're here. Yeah, so much to be grateful for. Way well
absolutely.
beyond all that, but
Man,
I
say
love
it
your
again.
energy. Yeah.
Say it again for the people in the back who can't hear.
Well, this is gonna be fun, Maya. This is gonna be awesome. Alex, how's your week been? How's the last 2 weeks been for you? Anything crazy?
Well, you're talking about weather, and we had the coolness here in the Salt Lake area last week, and it was awesome. I was like breaking out my coat and or my jackets and things, but now it's trending back up.
Yeah.
But other than that, yeah, just plugging away on AAPC projects and yeah, just loving life. Looking forward to the fourth next week. It's gonna be fun.
The
Hmm.
4th is next week. I think there's something weird about wearing coats in June. I'm sorry.
Yeah.
Yeah, Alex, there's something weird about wearing coats in June. I don't care. I
There
don't
is.
care where you are. Unless it's inside with a blanket, that's something. But coats in June just did not coincide together.
It was cold. It was cold.
Yeah, it's a
Yeah.
weird
I have
thing.
one more thing to say though. I have just my organization, my consulting agency, I just signed up to be on Project Extern. So I am really excited about some of the things that I have going on. I've just licensed myself to teach the CPC and the CPB. So this is going to be really, really an opportunity. And I just can't wait to make the huge announcement, other than social media, that I will be teaching and I will be an entity for Project Extern. So this is a great opportunity for people to learn and to be a part of that program and to assist with that process. So that's a big announcement. So
That's huge. Yeah. That's a big injection of energy going into that Project Extern now. So they need
thanks.
it. Yeah, it's good. Yeah, that's so awesome. Cool. And you're a CPCI, is that correct? Or
I
getting
am a
that?
CPC. I'm certified 7 times over. CPC, CPB, CRC, CPMA, CPCO, CPCI, CFPC.
Nice. Cool. You're,
Yes.
you're the right person for the job then. If I have any coding
Okay. All right.
any questions. But Maya, you've also presented at conferences too, right?
I
What's your
have. I
there?
have. I'm sorry. What were you saying, Dave?
What was your involvement in conferences like for you?
You know, I have two different perspectives on conferences now, one being a presenter and one working the conference. And as a presenter, I presented in 22, 23, and I believe in 24. I didn't present this year, but I will be in regionals and working the conference. And I think working the conference, you have an appreciation for what goes on behind the scenes, right? And I think that also, um, creates an opportunity to make sure that whatever the presenter is giving, that they have everything that they need, right? They're coming with a subject matter, but being supportive of anything, being interactive is always important when you're in conference, but working behind the scenes, you kind of see both dynamics and I'm very fortunate to have seen both and what the learner needs and then understanding what the presenter needs. And we need more people to be supportive of the presenter in addition to being the learner. So I think this is just a great time for people to understand both sides of the spectrum, whether you're working as part of the NAB or the CAB. It's just really something to be a part of it and see it from both sides.
Yeah, that's awesome. Yeah, you helped
Yeah,
us out a lot behind the scenes, running the virtual moderator or the virtual room for the, the breakout sessions that we had.
yeah,
And
yeah.
yeah, it seemed like you caught on to all that stuff pretty quick too. So you did a good job.
This is not my first rodeo.
Well, I'm just saying that because we're gonna probably, ask for your help again. So we'll see. So I gotta just keep building you up, be like, you are the best we've ever had. We
You
need
know what? See,
you.
but I'm feeling that, Dave. I'm feeling that. And I don't mind. You know why? Because I understand the dynamic of being supportive on both sides. I think it's important. We need to support each other and we need to understand what each perspective brings to the table. That's that neurodivergent side of my brain that understands everything that needs to happen at simultaneously.
Awesome. Cool. This is great. Yeah. Nice little plug for what's coming up too. So the perfect segue to bring in our guest. We have with us Katie Roemer, and Katie she published an article or got published in our last June AAPC The Magazine. And
Hmm.
we're going to bring her in. She's going to talk about neurodivergency, embracing neurodivergency. So let's bring her in and give her a warm welcome in the chat. Also, if you're joining us in the chat, Alex is manning the chat mostly. I'm going to be kind of doing more of the kind of the verbal stuff, but let us know where you're joining us from, what you're going to eat for lunch. I need some good ideas too. So,
I mean,
uh,
Panera.
what's that?
Panera bread. Panera.
Uh, oh,
It's still 10 o'clock here, so
Um,
breakfast, lunch, brunch time.
I wish it was a kava here, though. There's no kava here. I'm so mad. Those of you who are lucky to have kava, I hate you right now. Thank you.
thank you. So, Katie,
Katie must be in California or something.
yeah,
Yes,
where are you joining us from?
I'm from Los Angeles,
Ooh,
Okay.
where the world is doing fine. Thank you.
But the world is doing fine. You want to
It's doing
elaborate on that?
fine. It's
Her
fine.
windows aren't boarded up. They
Yes,
look good.
that's what I'm
Looks
saying.
normal.
Yep, it's just normal LA here. Nothing out of the ordinary.
Everything's okay.
Yes.
Cool. Well, that's good. I'm also on Pacific time, so I feel you.
Oh, nice.
Lunch
Where are
is,
you over here?
I'm in Northern California, up near Mount Shasta, really close to the
Nice.
Oregon border. Yeah.
oh,
Nice.
nice.
I bet it's
Oh, I bet it's
pretty.
beautiful over there.
Mhm.
Oh, I bet it's beautiful.
Yeah, especially when it's hot everywhere else. It's like, oh, like 70, 80 here. It's nice.
It's
Um,
also not hot here. It gets about like 70 or 80. So I feel
uh,
your pain with the.
are you in LA?
I'm in the San Fernando Valley. I actually live in Burbank. It helps just to say I'm from Los Angeles or in Los Angeles. It's, somewhere
Yeah,
that
just a
people can
little more
identify.
inland
You know
there.
what, Katie, when I hear Burbank, I always think about the TV shows. The Price is Right back in the day. Not that I'm aging myself, but
Jay
it's
Leno.
Burbank, California, 60028 or 90028. You're like,
Yep.
oh
Yeah.
yeah. That's
Jay Leno always said live from Burbank, California. And so I still think that too when I come over. We have a Flappers comedy club, and it's
okay.
Jay Leno, I guess, started there or comes there. Sometimes his name is on the sign. And every time I come over the Olive Avenue, I'm coming over the freeway, and it'll be like Flappers, and all I hear is Jay Leno live from Burbank, California. So,
Just saying,
yep,
but with Johnny Olson, oh my gosh, and Bob Barker.
yep.
If you'd like to be a guest, write us at.
Yeah, you had to
I'm
write in
just,
back in the day.
I,
Here's
Yes,
the address. Write in and
I'm
send us
just
a
saying.
letter.
Katie,
For those of
Katie,
you
are
who
you
are old,
native? Oh,
uh,
I'm
I was going
sorry?
to say, Katie, are you native Southern California girl?
No, I relocated about 4 years ago. I'm from the Midwest. I'm from an area that crosses the Mississippi River that's called the Quad Cities. It's where Iowa is northern to Illinois versus east and west. And I come from a Mississippi River town called Davenport, Iowa, about 100,000
I've
people.
been to Davenport.
Have you?
Yeah,
Very good.
yeah, yeah. I'm also a singer, and I travel a lot, and that's where I was in North Carolina. I was actually in an award show. Um,
Nice. Congratulations.
yeah, it's an independent industry award show, but we did one Artist of the Year and Group of the Year. So, but yeah, I was in Davenport for an engagement, so it's beautiful there too.
Yeah, and you can't beat the river. Having no water available is strange to me. Like there's a Los Angeles River and I see it sometimes, like when I'm driving, and there's signs that'll say like, here's the Los Angeles River. And we've all seen the movies where people are in, I don't know what they're called. They're the empty riverbed where it's all cement and they're like doing high-speed chases and they're in and out. And that's what the river looks like. And it's flooring because I'm used to the Mississippi actually taking up space. But yeah,
So different,
State
so
of the
different.
world.
yep, yep.
So Katie, you have written an article in June's magazine, and it's called "Embracing Neurodiversity." I don't want to say neurodivergency, but do you want to give us a little bit of a summary on maybe the article and what prompted you to write that?
Yes. I'm going to give you a little background about myself. It kind of helps set the stage. So I am a compliance and privacy officer. I work for a hospital system here in LA. I've been in healthcare for about 20 years. I started at 1-800 Medicare back with like the first donut hole or for Part D. So I'm going to age myself as well. Um, Eventually, I found my way into coding, auditing, education, compliance, leadership, etc. And like most compliance officers I've talked to, I kind of stumbled into compliance. I've been here about 3 years, and it's real. I'm sorry, I've been in compliance for about 13 years now. And it really is the perfect job for people who love solving puzzles, spotting patterns, and helping people figure out how to do the right thing. Without losing their minds over all the regulations. But I'm not always so um, stiff and impersonal. I do like to read books, drink coffee, and take my cat for walks outside. He likes to go on his harness and go for walks. Um, so about a year ago, I came across the term neurodiversity, and I didn't know what it was, and I went to read more about it and to listen to other people's voices and their perspectives. And it really did help shift how I understood both myself and the places I've worked and that relationship I've had with those places where I've worked. I realized that some of those things that make me really good at compliance, like the hyper focus, the pattern recognition, the problem solving, I tend to be very direct in my communication. I don't always understand, like when people use phrases like beat around the bush or close the loop or all hands on deck, and I've never quite understood that. My brain works a little more literally. I learned while researching neurodiversity that these were also the same types of skills that made more of those traditional workplace dynamics more challenging. Um, I wanted, when I learned more about it and I realized that these are more of my superpower, the identity that I really need to step into that I've carried with me my whole life, and they are what I'm good at. You know, the best thing we can do is be ourselves. Nobody else can be that for us. And I realized that if I, after this many years in healthcare and have worked in different departments and worked with different people, and I'm struggling with how the diverse way my brain works interacts with workplaces, community, etc. I've realized that other people are out there too with the same struggles or concerns, and I just wanted to let them know that um, it's not so much that it's a cognitive diversity, because sometimes that sounds like, disabilities under ADA, or, there aren't a lot of accommodations that are covered for people whose brains just work differently and don't have a formal diagnosis. And I just wanted to be able to tell people, like, hey, I have ways that my brain is different than other people's, and it's set me aside or it's called me out over the course of time. And if you're like that too, don't beat yourself up about it. Embrace those things. Find those quirks that make you different and, share them with the world, announce them from the rooftops, and really, really do embrace what makes you different and how your brain functions differently than other people. One quote I want to share with you. When I first started reading about neurodiversity, I read this great book called Neurodiversity in the Workplace by Alice Hewson. And I wrote this down in the way beginning, and I've been reflecting on it every time I think about neurodiversity. And she says, quote, "You wouldn't ask for a chair when you book a table at a restaurant. You would expect it to be included," unquote. And it's that type of perspective that I'm trying to communicate when I talk about neurodiversity.
Interesting. Yeah, that's so cool. I feel like, at least personally, I read your article and I was like, oh man, this is so good for everyone. I liked at the end that you talked about these things not only benefiting us in the workplace, but also just becoming and developing ourselves as humans and
Mm-hmm.
not being afraid to just let our light shine in whatever ways it shines. Even if it may seem like it's a little off or whatever, well, let's channel it and let's focus that towards something productive or whatever. But I know we all have those things, so it's a fun
Mm-hmm.
topic to talk about. Um, Maya, what's your take on neurodiversity? You've got kind of a personality that stands out, and you don't seem like you're afraid to take up a little bit of space, which I think is a great quality. Do you want to, I don't know, tell us a little bit more about
I think,
your pattern?
I think the concept of neurodiversity is like Katie said, I think it's a new term, but I also think it's about how we learn and how we observe things and how our mind is able, like you say, to comprehend the nature of the presenting problem, not talking E&M, but the nature of the presenting problem and how it can be viewed in so many different ways. But the ability to understand that and know how your brain works and how it translates to, how you're going to educate somebody,
Mm-hmm.
right? And then, understand what it means to be limited. And it also is a superpower because it helps you unpack the simplicity behind it all. It helps you unpack the simplicity. And for me, I'm naturally neurodiverse and I'm naturally very open about it. Like I say, I'd rather ask for forgiveness rather than permission, right? But I think that's also a barrier breaker or what's the word
Disarms.
uh what do you call that a conversation starter, right?
Mm-hmm.
Like really, so tell me what you think, or I mean it starts the engaging conversation. And I love that this term is bringing forward. And Katie Brock, Caitlin Brock, we've talked about this before too, and she'll say, I'm having a moment, I need to embrace this moment, I'm doing this, I'm doing that. And it just really makes it important for all of us to embrace how our different minds work and to be able to have an open conversation about it and be more willing to accept how we are different and not expect the same. Because if we expect the same, everybody's going to be the same, and we're not going to have anything um, conversational to say because it's going to be the same response. We all need to accept the diversity of our response and the diversity of how our minds work.
I appreciate your E&M terms in there. I have some past history with educating on E&M, and so I like that you um, can roll those E&M terms into just regular conversation. It's very familiar to me, and I'm like, oh, I understand. I can understand your definitions, and I can apply them more than if you gave me vague concepts. So I thank you, Maya. That was really great. I'm direct, which I've realized in the course of my time that um, it's not always something that people appreciate. I'm perfectly fine to say, can you show me the policy that helps me understand A, B, or C, or can you, um, I don't mind asking a person a question or going into a building and asking directions or is this the place I'm supposed to be or things of that nature. And sometimes I've learned when I talk to people face to face and I just come up with a question and I ask them, sometimes, especially in investigations where people will kind of hold back and I'll say, oh, I I'm aware that I'm pretty direct, but let me see if I can find a maybe softer way of asking, why did you look at that person's medical record? Something a little more softening for people. So I've been learning a lot more about my personality quirks and how they potentially come across, and then being able to identify them as well.
I mean, I think, Katie, I think you touched on a lot of different things, and I'm one of those persons that struggle with multitasking. So in your article, you talk about that, and sometimes it's about unpacking, right? And
Hmm.
understanding the person's frame of mind to be that third person. I always like to think of myself as a three-dimensional thinker, right? What would I want the person to say to me? How would I receive it? And what would I take away from the conversation if I was that person? And I think that's always very important, right? But I'll tell you this little story, and it's going to make everybody laugh. So don't forgiveness rather than permission, right? And I know we have 1 minute, but I was at a Great America, and they told me that I couldn't park somewhere, and I had a pass, like a preferred parking pass, and I said, "Show me in the policy where
Hmm.
it says I can't park here." And the security guard was like, "What?" I'm like, "Listen, if you say I can't park here, and I parked here all this time, and today I can't, I want you to show me in a policy where I can't when you let me do it before.
Hmm.
Don't be consistent with being inconsistent. Be consistent with being consistent." That's all I'm saying.
Yeah. Yeah.
Nice. Yeah, I really liked something that you said earlier, Maya, about expectations too. Man, so many times our expectations of how people should be or how people should act or how they should do their jobs often is just our own projection. It's our own expectation rather than accepting or trying to, I don't know, work with them in the way that they work. We have these expectations.
Man,
We get bothered, and I was going to say a different word, but we
And
get
that's,
upset.
listen, bothered,
hmm
It's our own
bothered.
expectations.
hmm recognizing that in yourself. Like I wouldn't like it if
Yep,
somebody looked at me or talked to me or something that way. So let me take a step back and make sure that I'm providing a safe space where we can be our authentic selves and we don't come at each other, with our own unmet expectations or
I
un
love that. Mhm.
uncommunicated. If you expect something from me, can you just tell me so then I can know what's expected of me and I can meet that versus
Katie, no Jedi mind tricks. Just tell me what's
right?
going on.
Unless I get a lightsaber,
Um,
if I and it makes the noise, the whoosh whoosh whoosh, then I'm okay with
man,
Jedi mind tricks. But
no, we're not doing Star Wars. We are not Jedis. My name is not Yoda. Please do not expect for me to think what you are thinking. No,
right?
we don't do that.
Yes, just be clear,
Documentation
clear
is perfect.
communication. Yes.
Yeah, I love that. And the direct communication, like you said, can come across as a little blunt. I'm a
Hmm.
Sagittarius, so astrologically, I tend to speak my mind, but I've had to learn. I mean, I'm also a Cancer moon. This isn't about astrology, but it softens me a little bit, and I have to lean into that sometimes to be like,
Yeah,
okay, I need to soften it a little, soften my approach a little bit so
yeah.
that my communication can still be clear, but can be kind.
Hmm.
Yeah. Yeah. I think that's the three-dimensional process that we all need to practice. What would we say if it were ourselves, and what would we take away from it? And what would we understand if we were saying that same thing to ourselves? So I think that's really important to understand and how we take that away and being in a neurodiversive environment.
Hmm. Yeah, well said.
So, Katie, you talked a little bit in your article about being hyper focused, and that made me think about this is like a tell-all for me. I'm a musician, so you mentioned that you
Hey,
sing or whatever, but
sure.
I used to write songs and I would get so hyper focused in my recording of songs that I would start the day and then I would end the day and be like, I haven't eaten anything, I haven't talked to anyone, I've just been so heads down, so hyper focused.
Hmm.
Yeah, and I realized that that can be a superpower if it's managed correctly. If I'm with other people in the room, it can be really annoying because I'm really hard to get, a hold of. So,
Hmm.
yeah,
I can
Yeah,
do
that,
that with audits,
yeah,
definitely.
same.
Or if I'm researching something like neurodiversity, where I'm constantly listening to audiobooks or I'm reading articles and I'm not talking about anything else. So I imagine that would be a lot like writing music because you're trying to understand the core concepts and how can you communicate that out directly. But I can have a whole day is gone and I'll look up from, say, an audit or something I'm reading about or learning about, and I'll just be like, who are you people? Do I live with you? Like, what just happened here? Am I in a whole different portal or a different timeline. But then I have this great thing that I've worked on, and I'm sure when you both of you are writing music or you're creating your artistic endeavors, when you come out of that, you probably have something purely magical because you've been
Yeah.
able to give all your time and focus to it. That's
Yeah.
wonderful.
Yeah, I like to call that the process of connection, right? You don't want to break the connection. And sometimes if you break away from it, you use the creativity if you break the connection.
Hmm.
So staying hyper focused is about the ability of staying connected while the energy is high with that connection. But when you break away from it, you lose it or you feel like you lose some of it, and then you have to get so much momentum to bring it back.
Hmm.
So I understand that hyper focus. I deal with that quite a bit, especially when dealing with an audit and you're trying to find that puzzle, and it makes it so hard because you're like, what the heck were they thinking? And you
Yep.
see the same thing over and over when you look at a note and you're just like, oh, I'm hyper focusing again. And my husband will be like, you're doing an audit, aren't you? Yeah. Okay. I'll see you in the morning.
Yep. Yep. Going down the rabbit hole, trying to remember what your scope is,
Yeah.
finding other patterns that maybe you didn't think were the patterns that you were looking for in the first place. No, I think it's great. It's a wonderful uh, productivity tool from, I think, the perspective of intending to get something done. Definitely there are negatives or weaknesses to everything, but I like to just focus on positives and strengths and how we can support each other.
Same. Positive empowers leadership. It empowers change.
Hmm.
When people come in the room positive, then there's nothing that can go wrong because everybody has the same purpose.
I would agree. That's a great way of saying it, Maya. Hmm.
Thank you.
Love it. Cool, Katie. We're about out of time with you, but do you have any parting words for us or for the rest of the audience that you'd like to bestow upon us?
Um, I thank you for your time. Thanks for inviting me. Play to your strengths. I mean, it, I've really been repeating and telling people you are the best, most qualified person to be you, and nobody else can be you. So bring your whole self to the table, to the room, to the relationship. And the people who need those skills, you guys will find each other. And I think that
Yeah,
just be yourself, be
I
positive,
love that.
be yourself.
Love the article. Love this. You are your own limitation, right?
Yes. Hmm.
I love that. Oh, girl, write some more articles.
I will. I'm happy this is the result of it. Yes, I will. I will write some
Awesome.
more articles. Thank you.
It's been so fun, Katie.
Thanks,
Thank you for
Katie.
joining us.
Bye.
We'll see you next time. Maybe we'll see you at conference too. So,
Nice.
see ya.
Yep.
That's my food here. So if you hear my dog going ballistic, it's because somebody's at the front door. So I apologize.
Thanks for the
Hey,
one.
Maya, Jessica Johnson. I don't know if you know her, but in the comment she says, "I see you, Maya," and then she says, "She's a legend. I love
Oh
her."
my gosh, I am not a legend. I'm a clown in a uniform. That's what
Now,
I am.
Maya, I asked her. I said, "Do you have any Maya stories we need to share during the broadcast?" She hasn't responded yet, but I'm hoping that we get some gems in
Oh,
here.
yeah.
Nice. Well, cool. As you can see, we have with us for this second segment, we have Rita Genovese and Ellen Hinkle. So we're excited that Ellen and Rita are with us to talk all things AI. Yeah, we're going to be talking about AI in the industry. So it's going to be kind of an open discussion. I mean, we'd love to take some questions and even some comments from the chat. And Alex is, furiously manning that as well. So, but let's talk to Ellen and Rita. How are the two of you doing today? Ellen, let's start with you. What's your day been like? How have you been?
Doing good. Busy, busy. Lots of job security and compliance. So always things to do.
Nice. Job security and compliance. Do you feel like things have changed with a new administration, or is there always kind of like a new sort of getting up to speed with new regulations or anything?
Not, I mean, of course, there's new regulations always that we have to keep up on, but not so much bearing always on compliance aspects. There's just, always things that are occurring that people need guidance and education and correction on. So
And
Agreed.
oh, sorry. Was
No, I
somebody?
just said agreed.
Oh, okay. Nice. And Rita, how about you? How have you been today? Anything?
Good. A little busy. A lot of projects we're working on for expansion and things like that. So it's been a little busy here, and as you know, extremely hot in Philadelphia.
So, AI, let's talk about it. In compliance, Ellen, are you seeing AI sort of making its way into the workflow there?
From the standpoint of my daily job functions, we haven't gotten too involved with using AI to perform our daily job tasks. However, physicians
Haven't gotten too involved.
are using DAX Copilot for as an AI scribe type ambient listening platform to complete their documentation. So that is impacting my team from an auditing perspective because they have to be aware of when it's being used and auditing, to make sure that it's being used appropriately and that, they're getting the appropriate consents from patients to both record and use that AI technology to complete those encounters. Um, it's raising questions for us from a compliance perspective. My team performs E&M audits annually on every provider. So when providers are using the DAX Copilot, we're really looking closely and have audits slated as part of our work plan to really assess, our is the use of that technology helping to improve the documentation? Are we going to see physicians who maybe historically were poor documenters and not supporting the level of service? Are they now going to be supporting those levels of service? A lot of times we know they're doing the work, they're just not documenting it. So will that technology now help them in that regard? So um, yet to be seen, because we haven't, started that work plan audit yet, but we're anxious to see what the turnout is for that from that lens of looking at the AI.
Mm.
So
So,
I could piggyback on that because our physician started with the Copilot as well. So I had a conversation with one of our providers who is a really good documenter, but wasn't always capturing everything that he did. And he loves it, and we've been rolling it out every couple, piloting out several physicians at a time. And, one of the comments he meant is the depth and detail in my documentation is significantly improved. Because there's some things that you can pull in, some things that when he's talking, it's recording everything that he's doing, it's capturing, patient complaints or patient history, literally word for word, and many times without error from a, spelling perspective or things like that. So it is a useful tool. We actually piloted the original version of DAX, which was a little bit more confining because it was, I think, aimed more towards primary care. And when you start to get into specialties, it was difficult. But with the co-pilot version, it has added so much to the documentation, but also decreased time for these providers because two of the biggest things are on their, from their standpoint is documentation, takes a while because they have to do a lot of things now. We have to do social determinants of health. We have to do pain scales and so many other different types of documentation. But also the depth of documentation has improved. And it also, authorizations is the other piece, right? That takes a long time for them. So where we can save time for them, where they're able to actually get through the day, is really what the push is. And so far, we've seen a lot of great information come across.
that's good. Do you find that when it's kind of massaging the conversation or whatever, recording the conversation and then giving you kind of a review or a recap of it, which is what I'm guessing that it's doing, do you find that it's missing important pieces or is it catching pretty much everything?
Right. What we've seen lately with the providers that we rolled it out to, it's actually quite good. There's not missing things where they were before. And we have coders that review everything. So from their point of view, they've even seen the difference with some of our providers as well.
It's awesome. So, in what other ways, I know this is specifically, you said that the two of you have sort of piloted this same Dex Copilot, you said. Are there other AI tools that are being used in your facilities or offices um,
I
that are
think
up and coming more and more?
there's been a lot of demos lately, demonstrations from organizations for computer assisted coding systems, and then looking at the EMR itself, what they can do as well. We haven't really technically rolled out anything yet, but there are systems out there that are demonstrating what can happen when you have that type of assisted coding. And I think that there are some things that can help with AI, right? Like we talk about audit support or pre-coding automation where, yes, they can pick a probable code, but then a coder is still reviewing that, right? And kind of decreasing time and effort from the coder to be able to produce more because they're not, stuck on a particular situation. Some things it helps with is repetitive coding for routine procedures. So if you're always going to do a certain, let's say, breast surgery, right, that really only qualifies to maybe one or two diagnoses, and maybe able to assist with that. Error detection. So there's a lot of things that can happen, but coders still have to be involved, right? Like it doesn't replace us, right? It enhances us. Same thing. We went towards an EMR. People were like, "Oh my God, we're going to have EMR. We're not going to be able to do this and that." When coders actually took a bigger piece of representation when we rolled out the electronic health record, because of all the other things that we do, the work queue volume, making sure your templates are accurate and epic. So there was a lot of things that we still do, even though we utilize AI or electronic measures.
Yeah.
Yeah.
Go
I'm
ahead.
sorry. Now, I was just going to say, I've dealt with AI too, and probably in the same respect that Ellen and Rita have. But I think one of the things I also do is I'm also an expert witness for coding and billing cases. And one of the things that I have come across and what's happening a lot is when AI is used the wrong way, right?
Mm-hmm.
When it's used the wrong way. And a lot of insurance companies are getting in trouble because they're using AI to deny claims or to approve certain things. So when you're dealing from that perspective, there's a good side and there's a bad side, but the takeaway for using AI is augmentation. It should be augmented and it should never be automated. And because we're dealing in a day and age where we're looking for more automation rather than augmentation, then the perception of the use is always misperceived because you don't have people like coders or people that are in compliance that are associated with the building of the process. And I'm sure Ellen and Rita can also confirm that there are always people in our inbox wanting us to sample AI products because, and there are some good actors and there's some bad actors. There's more bad rather than good. We all know that. But the thing is to understand the coder's role in developing and not correcting the use of AI. So it's definitely something that we all know that we are not going to go away. In fact, it's going to be more prevalent that the coder is going to become more of the auditor than the coder, because we're now looking at certain things to see if this is really what happened. And so I was talking about this earlier. I think that the augmentation should be the focus and not automation. And once we learn that it should be augmented and there should be some tangible aspect of AI to be incorporated into the use of it, then it becomes more effective rather than defective.
Well, there's also, you have to remember, like in AI, there are limitations, right? When you think about ambiguity in documentation, right? That's not going to be able to do anything, right? You need a coder to really look at that. Or when clinical judgment comes into play, I could tell you in our environment in oncology, that's a lot, right? So we have to continuously look at that. And then compliance and ethics comes into play as well, right? So you have to remember that that's all human intervention. So that's why we're not going away.
Yeah,
The,
agreed.
Augmentation.
that automation has to be programmed by a human.
Right.
And, we see it, I'm sure you both do as well, ladies, in the electronic health record. So much of what occurs from a billing and coding aspect is automated.
Yeah.
And the disasters that can be created when somebody makes one little tiny mistake when they're programming that automation, can be, huge. issues and needing those coders to be there to catch those things and correct those things and make sure that programming is being done correctly from the get-go so that those problems aren't created and spiraling out of control. So,
And you also have somebody that has to monitor it, right? Everything that we do, you have to monitor the process. You have to, make sure that it's up to par. Things change all the time. I mean, how many times has things changes in the past 3 years? And, people try to enhance work queues by saying, okay, this code gets a 25 modifier, and that's not always the case, right? So,
Oh my gosh.
there's
Rita, I got two words for you, girl. Auto release.
yes,
Every time
yes,
somebody says
yes.
auto release, I'm like, no.
No, mine is HB background, which drives me crazy when I see something's coded HB background. That means nobody ever saw anything in the system.
No.
So,
And yeah,
so those are the things, right? Even though you still try to program some of this, it's not correct, right? So we need to look at this. You need to look at everything.
yeah,
So you do need human intervention to even control the controls, right?
right.
So that's why, we have to make sure that, everybody is aware of that.
Yeah. I
There's a
always like to use,
comment.
yeah, I'm sorry, go ahead.
Oh, that's right. There's two comments. One to Leah Fortier. She says, "Hi Rita, I miss your face." Two, Christy Berry Thomas says, "As a medical transcriptionist, I've been through AI and VR. Coding is my
Oh,
next step, but after being replaced so much by AI already, it's absolutely terrifying." Thoughts for Christy?
mm,
I have a thought.
Yeah.
So
So I think,
perspective is everything, right? And with AI, AI is being developed to mimic things and processes that you already do innately within your own brain, within your own energy field. So here's the thing. If you're worried about AI, just realize what AI is trying to accomplish, you already have so much of that power within you. So it's about utilizing the tool, not being replaced by a tool. It'll
yes.
never be
yes,
replaced. It'll never be able to like be your human essence. We're miracles. We're amazing. And there's, I don't know, just from that
Yes.
standpoint, I think that perspective, we're going to be okay.
I gotta add a comment because this is a perfect segue to all right, anybody who knows me, I'm a movie buff, right? I'm a movie buff. I love movies and I like to compare things with movies. Shut up, Rita, I see your face. So,
don't ever
there's
sit
a
next to
scene in,
Maya at dinner.
so anyway, there's a movie. I'm gonna get you later. I see you. I see you. So when we think about the movie, there's called Avatar, right? And there's a scene where Sigourney Weaver talks about the connections that the Avatar people have with their Earth. And we think about the branches, the roots of the branches. And she says there's more connections in the roots of the branches than there are in the human brain. So that goes back to what you said, Dave, about the brain, how it works, how it's unique. We have neurons and neurons that are upon neurons, right? So AI can only be so many times above those neurons. Like we think about the branches in cardiology, right? There's a first, second, and third branch. I hate it. Don't ask me to code anything from cardiology, but you think about the first, second, and third branch, but think about the neurons. There's third to the third power of neurons that are associated with the body. And if we think about how that only goes into three levels, then that's the extent of AI again, because it can't replace the human brain. The human
Right.
brain is too complex, right? And I think when we think about these types of things and how AI needs to be augmented rather than automated, there has to and will always be a level of tangibility that's needed to make it right. If you put something in Chat GPT and Chat GPT spits out something and you're like, what the heck were you talking about? That's AI at its
Yeah.
worst. Garbage
Yeah.
in, garbage out. So you have to think about how many times have you put something in Chat GPT and it comes correct. And then you think about the number of times that it's incorrect. And that's the connection or
Hmm.
the level of correctness that's associated with AI. So I think when we think about it from that perspective and how we make that application to Chat GPT, then that would be the equivalent to how effective it can be at times, but then also not as effective at times.
And you got to remember, AI is a tool, right? That's what it is. It's a tool. It's like any other tool we have utilized in assisting us, right? People use 3M, they use, all these other types of functions that help, right? Craneware, but AI is a tool. It's exactly like that. So how we utilize it best, is how the input that you put in, how you review it, what, like Maya said, sometimes it's not good.
Yeah.
Right. So you have to really understand it and just look at it. Hey, this is an extra tool I have. I think sometimes organizations may not communicate accurately what AI is and what is the expectation of AI and how do we integrate with AI. So, that's something that we have to remind everybody in our coding world, right? Think about this, like, coders need to understand what AI is, right? They need to understand, how it arrives at a decision, right? It's like looking at the logic of the tool. It's the same way, like if you're in an EMR and you're creating a work queue, what is the logic you're creating for it? That's how AI has to be looked at. Like, what is the component? What is it? What's the driving force, right? Coders, right? They need to validate AI outputs, right? We said that you have to look that you can't just submit, and you have to take a look at also the accuracy of it and going back to compliance, right? We look at everything with a compliance piece of our brain, right? Like, this doesn't sound right. This doesn't look right, right? The documentation doesn't say that, right? So it's the same thing, right? It's the same thing, just using this as a tool.
Absolutely.
And I think from a coder perspective, especially somebody who is looking to enter into the coding field, it's understanding that there is always going to be a need for coders. How that looks may change. What the function and job role for those coders is not going to look the same as we become more automated, but the need is always going to be there. So it's coders being open to functioning in a different way and utilizing the skills that they have to perform those same functions, but differently.
Yeah, I agree with you, Ellen. I'm sorry.
No,
Go ahead.
Yeah.
No, I was just going to say, a lot of people, when they think of coders and they think of AI, we always roll our eyes like, ugh, do we always have to talk about it? But the reality is it's integrated into our workflows. It's integrated in our everyday lives. I mean, if you go into ChatGPT, it would even suggest coding scenarios for you. So you really have, I'm just keeping it real, right? You have to incorporate that. And, I was one of those people for a very long time that really had the annoyance of AI, but it's in everything that we live and breathe, right? If you're even chatting on a chat bot, that's AI. If you're on a customer service line, you're going to get an AI. Hi, can I help you today? Let me connect to you. You're just like, seriously? So it's part of life. It's part of our everyday and it's part of the present. And we need to embrace the present inclusive to AI, even though we roll our eyes at it, even though we don't like it, AI is automation, but AI is automation now with a brain. But that brain is only as powerful of how it's programmed. And so when we think about that, we have to understand that, keep that in mind, that AI is not perfect. It's just a tool, like Rita said.
And think about
Rachel
this.
Wilford.
Go ahead.
Sorry, Rita. Rachel Wilford in the comments says, I think the AI vendors are making promises to organizations that they can save them money that result in negative changes that affect revenues for coders or revenue cycle teams. So I don't know. I mean, sales guys, they overpromise, right? But I don't know. Have any of you had those kinds of experiences, or do you sense that maybe AI vendors might be overpromising at times?
I'm gonna compare this to our EHR vendors. How many EHR vendors promoted all those crazy tools that the EHRs can do that make the life of the physician easier? The copy paste, pull forward, the templates. I just did a presentation on this last night for Rita's chapter. And we found that when those things were being used incorrectly, it creates more problems and more risks and non-compliance. So it may not be the same exact type of scenario, but I think, again, the vendors are going to promise things because they want to make the sale. And then, when we start seeing the reality of those promises, there's going to be problems with it. And that's just going to create more need for our coders.
Yeah.
Yeah, I
And
mean, and it's go ahead. I'm sorry, Rita, go ahead.
no,
I
no.
know you.
So, so when we think about AI, they're trying to integrate it in a lot of healthcare areas, right? And we had a demonstration about scheduling AI, right? And if it's cut and dry, but if a patient has all of these issues and problems, AI can't handle that, right? It's got to go to a human being who's going to be able to clinically assist the patient to be able to be scheduled appropriately. So, sometimes it can handle this appropriately, but then there's that other piece that it can't. And when you think about this, like AI doesn't have analytical thinking.
No.
No matter how much input you put into it, they don't have analytical thinking, which is what we do, right? We have analytical thinking to deduce it and review and understand what the issue is. So that's when you think about it, right? Yeah, you could be techie and have that tech literacy, but the analytical skills are not embedded in that.
Yeah. It's only 3 levels up, like the cardiovascular chain, right? The branches on the branches. But what I was going to add, Rita, and I did this presentation at RISCON, and it was really by fluke because one of the young ladies didn't or couldn't make it, so they asked me to step in. And so I started to look at AI as it relates to risk. And what was happening is, as appropriate for risk adjustment, the OIG is now looking at AI tools because they're trying to abstract from the HRA for chronic conditions.
Mm-hmm.
And part of this problem is that the HRA is self-reported, but you're trying to collect risk adjustment dollars based upon HRAs, which is self-reported as part of the Medicare exam. And you can't do that because there's no meat, nothing that's monitored, evaluated, assessed, or treated, because it's coming from the patient's perspective, right? There's no real tangible exam except for you're doing great. This is a personal plan prevention service. Yes, you're doing great. Come back and see us, and then come back next week if you don't have any problems. But again, you can only really capture the HRA if there's something that's being managed that's going to be in an E&M when that Medicare awareness visit is coded. So the AI portion and the risk behind it is already real because the OIG is already looking at it.
Yeah. What a crazy world we're just on the precipice of, but I'm excited for the different tools and things that are going to come and are going to make our lives easier, not just in this industry, but in general. I think, kind of have you all summarize, it's how we use them, it's how we train them, it's how we program them, and that they can't replace us. They'll try and mimic us, but we can't really ever be replaced.
Oh.
Dave, we talk about this on the marketing team, right? We've had marketing automation and now AI, and even marketing automation, there was fear of replacing marketers, but it didn't happen. There still is a place, but we need to adapt and
Yeah,
embrace the
it's
tools.
exactly embracing that diversity too, right?
Yeah.
Like
Yes,
we can use it as a creative tool to really help even just our own, like if we want to come up with our own personal plan of, hey, I'm working on this specific skill, talk to Chat GPT and be like, hey, can you give me a step-by-step plan of this thing that I want to accomplish? There's so many great ways we can utilize it. And I think that's really
absolutely.
going to be cool to see is how creatively we can use these AI tools to augment, like Maya says.
Yeah, stop thinking of AI like iRobot or Star Wars. AI is not iRobot and Star Wars, but I would love to see Will Smith in the shower again. I'm just saying. Ah! All right, I'm sorry. I'm just throwing it out there, but AI is beyond the iRobot. AI is to assist us.
Yeah, love it. Well, this has been a really good discussion. Alex, is there anything more in the chat? I noticed Lori Jaramila's comment of, she said, sometimes I want to slap AI. I thought that was funny.
Yeah,
I call
yeah.
AI, I call
There are
Chat GPT Chad. I just named him Chad, right?
yeah,
So I talked to him. I'm like, all right, Chad, here's what we got. And it's, I
there
don't know,
are
personalize it, but it doesn't have to take over
yeah.
your life.
Well, now I know when you're talking about Chad, I know who you're talking about. So I've
Yeah.
had clarity now. But
Slapper
With that, there's so many great comments. We can't address them all. Rachel just followed up saying, speaking of risk of another type, there's a risk of bias with AI.
Yes.
It's designed to put square pegs in square holes. It can't
Yes.
always dismantle the solution of one-off situation. So if you to our panel, if you get a chance today later, just scroll through the comments, respond if you feel inspired. But
Definitely.
I just want to thank our viewers for having such an amazing discussion about AI, neuro paths, and brain stuff. And we covered so many topics from lunch to weather to AI. Yeah,
Will
we
Smith
covered
in the
the
shower.
Will Smith
yeah.
in the shower.
We've had newbies. We've had newbies come in the comments asking for, or just saying, "Hey, I'm starting this path." And Social Hour is awesome, guys. And this was a energetic broadcast. So thank you.
Love it. Thanks, Alex. Ellen, Maria, Rita. I called you Maria Rita just because your name's Maria Rita, but Rita, Ellen, Maya, thank you
Maria.
so much for joining us today. It's been fun. Hopefully, we'll get three of you back again because it's a good time talking with y'all. So,
Okay.
hopefully, the rest of you enjoy the next 2 weeks, and we'll see you in a few. And keep
Happy
coding.
4th.
Have a
Keep
great day,
coding.
everybody.
AI is not iRobot. Remember that.
But go watch it just to,
Yes.
all
Will
those.
Smith.
Yep, man.
Maybe AI can create a version of Will Smith in the shower for you, Maya.
There
Yeah.
you go.
You know what? I would think about our regional, I mean our national running joke.
Mm.
The
Oh
shape.
yeah.
Might be an inside
Thanks, you
joke.
guys.
We'll have to share it
It's an
later.
inside joke, but you guys have a great evening or great rest of your
Take care,
afternoon.
guys.